Hello everyone, welcome back to another episode of M.I.N.O.R Talk. My name is Wan Xian and I'll be your host today. Our topic for today is Otorhinolaryngology, which is also known as the ear, nose and throat, ENT. We are very honored to have Dr. Julius Goh with us today to give us an insight into ENT. Dr. Julius, would you like to introduce yourself?
Hi, my name is Julius. I'm actually a lecturer from the Faculty of Medicine, University of Malaya. I'm a practicing ENT surgeon, also known as an Otorhinolaryngology surgeon in Malaysia. And it's been my passion to be practicing this for the past few years. And I'm actually subspecializing and have a special interest into sleep apnea. So thank you for having me in this M.I.N.O.R Talk. I'm very honored to be here.
Thank you, Dr. Julius, for your introduction. So now, could you please introduce ENT?
Right. So ENT is a medical discipline, first and foremost, that has a combination of both surgical and medical aspects. We generally focus into the ear, nose and throat region. Amongst the commonest diseases that we actually approach is ear diseases such as otitis media, foreign bodies of the ear, even infections around the facial skin. One of the commonest diseases that we actually approach is also such as the sinuses, deviated septums, tonsillitis, sore throats, voice changes, and of course sleep apnea itself, which is part of my interest and specialty. Thank you.
Okay, thank you, Dr. Julius. So when we talk about ENT, one of the breathing disorders is known as obstructive sleep apnea, which is mentioned by Dr. just now, in which breathing stops and starts repeatedly. So the second question I would like to ask is, how do we know if we have sleep apnea or just snoring? Can it be a silent sleep apnea?
Yes, that's a very good question. So what is sleep apnea in the first place? By definition, it's a medical jargon. Okay, so sleep apnea means that you stop breathing when you sleep. Okay, when you stop breathing when you sleep, it means that there's no air going into your lungs. Okay, and that causes a lot of problems in relation to this. Amongst the commonest problems is just like diabetes, hypertension. You can get a stroke in long term. Okay, but very importantly is that when you don't have enough breathing, what will tend to happen is that you don't have enough sleep the next day. You feel very tired, you feel that you have lack of concentration, you have a loss of memory, and very importantly, sometimes even your spouse, your partner, or even your brothers and sisters will complain about your snoring, So these are the things that can come, but one of the commonest symptoms that the patient can come is snoring. Snoring is when you breathe so loud that you make a very particular sound when you sleep. Okay, I'm sure everyone have experienced it. But then again, there's also cases whereby patients who have sleep apnea does not have snoring. So that's what we call the silent OSA. So these are the patients that actually come to us in a regular basis, and we do a regular assessment for patients that come to us in order to detect if your apnea has been causing you an issue, So that's what we see in ENT. Yeah.
Alright, it's clear that not all snorers have OSA. At the same time, non-snorers can have OSA too. The third question I would like to ask is, how is obstructive sleep apnea diagnosed?
Okay, that's a very good question. First and foremost, there's no straightforward answer to this because it involves multiple ways that we can combine all the factors in order to diagnose this. So the first thing we generally do in our clinic is actually to get a very detailed history on the patient's sleep pattern and why the patient is brought here. For example, if a patient might be brought in by their spouse for very bad snoring, then they may actually notice that the patient is having gasping when they're actually sleeping. The other reason is because maybe they have not enough sleep. They might actually come to us, say that they cannot sleep at night, and because they say they are drowning, they feel in pain, they feel in distress, that's why they come to us. And then we will proceed with examination. Examination means we will do an examination of the face, we look at the throat, we do a flexible scope to see what's within the airways and see if there's any evidence of obstruction. Okay, and then last but not least, we will refer the patient to a sleep study. What is a sleep study? It's an overnight study where we can do it at home or we can do it in a lab. We put a few leads around your chest and also from the brain to check for the brain waves. And from there, we will check how much apnea you will be having at night. And from there, we will decide and make a complete diagnosis if the patient is having a significant amount of apnea. We will then grade the patient based on what kind of apnea is having. For example, there's obstructive, there's perhaps even central apnea. There's so many types of apnea that the patient may be having, and of course there's other sleep disorders they might be having. Once we have established the patient of sleep apnea, we will give the patient a few options, and we will discuss with them and counsel accordingly based on what the patient is having.
That's very informative.
Thank you.
Since you have mentioned the diagnosis of OSA, would you like to share some treatment options for the patient?
Yes. So there's no one set answer to this question because OSA is very, very personal, I would say. In a personal means that everyone is different. So it really depends on the needs and the wants of the patient. If the patient is a bit on the active lifestyle, maybe they might not be suitable for certain type of treatments. So the cornerstone of treatment for OSA is three things, which is CPAP, positive airway ventilation, okay? The second is surgery, and the last is what we call a mandibular advancement device. Generally, it depends on how the patient has presented to us. If the patient is more on the type that can tolerate CPAP, that is always the gold standard. But if you are unable to tolerate CPAP, we have also options for you to try surgery, and also advancement devices we can put in the throat or near the jaw in order to push it forward so that more air can go inside to eliminate your snoring. So it's not for everyone. No such thing that one answer fits all. You come to a sleep clinic so we can customize the treatment based on your needs. So that's what we usually treat OSA.
Now we know that there are a lot of ways to treat OSA. Here is my last question to you, doctor.
Yes.
As we know that there are a lot of loud snorers do nothing right now, do you have any advice to the patients or public on how to get rid of obstructive sleep apnea?
Okay, so the best answer to this, if you have loud snoring, please see a doctor. Okay, try not to self-prescribe the treatment for yourself because sometimes snoring might be a herald to something much bigger. See a doctor, especially when it comes to OSA, see a sleep doctor because you need a complete assessment of your airway and also you need the proper history, and this is usually done by a professional. Look for a sleep doctor, get a proper diagnosis, do a sleep study, and then from there we will cater the treatment for you. Okay, there are many devices in the market available, but please do understand that at the end of the day, customization and personalization of the treatment is key to treatment. That's what I would say. Thank you.
Okay, our discussion has come to an end. Thank you so much, Dr. Julius, for this insightful sharing session.
Thank you for the honor, and I wish you all the best. Thank you.
I learned a lot today, and I hope everyone who is watching this video will remember Dr. Julius' advice. Thank you for watching, and stay tuned for the next episode. Bye!